More than 36 million Americans have diabetes. 90% or more have type 2 diabetes, which has become a major health crisis, contributing to high rates of obesity and cardiovascular disease. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. With me today is Melissa Magwire, Program Director of the Cardiometabolic Center founded by St. Luke's. Thanks so much for joining us.
Thanks for having me.
So Melissa, first of all, there are two different types of diabetes. Can you explain the difference between those two and why this is a population health problem?
Sure. So type 1 diabetes used to be called juvenile onset diabetes. Type 1 diabetes is autoimmune, meaning something triggers your body to no longer make insulin. It's a far less percentage of the population. Type 2 diabetes has more of a genetic component, but also has some risk factors like obesity and uncontrolled weight that fit into that. And unfortunately, as a society in the United States and across the world, we're getting heavier and heavier. So we're seeing those rates really explode. And you know, you mentioned how many folks are already living with type 2. There's a subset that have it that don't know. And it's projected about 8 million more Americans, at least, per year developing type 2 diabetes. And then there is a huge risk for cardiovascular risk, kidney risk that goes along with that. So that's why this push to really gain an understanding and get a hold of it is really happening.
Absolutely. 8 million a year is such a significant number. So why does having type 2 diabetes impact a person's health?
So with type 2 diabetes, you hand in hand often see obesity. And with obesity, we also see things like hypertension, heart disease, heart failure, kidney issues, eye issues, liver issues. Now, those things don't have to happen, but if you don't have the adequate care and we're not paying attention to those signals, that can certainly happen. And unfortunately, cardiovascular disease is still the leading cause of death for those living with diabetes, type 2.
So who's at higher risk for developing type 2 diabetes, and what are some of those risk factors?
So certainly somebody with a family history of type 2 diabetes, because we said there is a genetic component to that, but also those that might be carrying some extra weight. It's kind of chicken and the egg, though, because there is a facet of type 2 diabetes, insulin resistance, that can kind of cause you to maintain weight. But having said that, we know as a society we're overweight. So being overweight, having that family history, and maybe being inactive can kind of all set you up for a history or a prevalence of type 2, as well as somebody who's had gestational diabetes while they're pregnant.
Okay. So what can people do to help prevent the onset of type 2 diabetes then?
It sounds simplistic, but it's true. The number one thing is just to live a little healthier, to get that weight under control, to get all of those risk factors like your weight and your blood pressure, get your heart checked, stay in tune and in touch with your care team, and really work at educating yourself on knowing what those risk factors are. And something as little as being active 150 minutes a week. There's a lot of stories out there saying it has to be high intensity, low intensity, just move. 150 minutes a week and follow a healthy diet.
Okay, good to know. So St. Luke's has a Cardiometabolic Center of Excellence. Can you talk about how this center came about?
Sure. So there were those of us that were sort of working in the cardiovascular diabetes space and those in the preventative cardiology space. And we weren't really getting the outcomes that we wanted. And so in 2018, 2019, was privileged to start working with Dr. Mikhail Kosabordin and James O'Keefe to kind of come together and say, look, why aren't we able to move the needle and decrease the risks in these patients? And so we formed the Haverty Cardiometabolic Center of Excellence back in 2018, where we looked at that approach of not just looking at glucose and diabetes and heart disease and kidney disease, but really taking that global approach to kind of touch all of these aspects that these folks were living with.
Okay, so you already mentioned that this unique approach. Can you talk about the treatment model and how it really helps patients?
So it's very care coordinated in focus. And so we understand that these folks are dealing with multiple providers, multiple disease states, multiple medications. And so we go in as a team. And we make sure that that patient has all of the education that they need. But it's really that nurse coordinator that anchors that care and ensures that we are communicating with the rest of the care team as well as the patient and their family. From things as, do you have the education that you need? Do you have the medication that you need? Can you get the medication? Do you know how to take it? Are you staying on it? Are you having side effects? Making sure we don't lose patients to follow-up in between appointments and really coordinating that care and that pathway for that patient.
That's great. So with the model of this center, St. Luke's formed the Cardiometabolic Center Alliance. Can you talk about what that is and how the Alliance is helping patients across the country and across the globe?
It's been very, very exciting. Early on, we started to see really good outcomes at our local center here at St. Luke's. And so we started fielding questions from other healthcare providers across the country saying, okay, how are you doing this? We're not able to do it. How are you doing it? So in 2020, with the help of St. Luke's, we formed the Cardiometabolic Center Alliance, which is essentially a nationwide healthcare consortium of healthcare centers who want to take this approach in their own communities. And so we looked at all of the protocols and things that we did in care pathways here, and we have helped share that with these other centers and are working to open centers across the country, as well as potentially Latin America and other countries where there's really an at-risk and a patient population that's in need of this.
That's fantastic. How many centers do you have today?
Yeah, we currently, as of today, have 16 centers in the United States and are hoping, like I said, potentially to open in Latin America in the next 12 months. So.
Fantastic. Is there anything else you want to add?
No, I think it just continued to make the point that this is a team effort. And we have that coordinated team within the center, but we also rely on our other care practitioners as well. And we say, hey, we're going to take the heavy lift for that 9 to 12 months, but they're still part of your care team. And we still very much communicate with our endocrinologist and our primary care for this kind of very patient-centric approach.
Absolutely. Well, thank you so much, Melissa, for joining us.
Thank you.
To learn more, you can visit stlukeskc.org/cardiometabolic. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.